Our presentation was about Lumbee Native Americans and increased cardiovascular disease risk. Our group research was done by Jeremy Harper, Danielle Gilbo, Amber Ewing, and Jacqueline Green. Demographics. The Lumbee Native Americans are the largest group of American Indians in the East and the fifth largest in the nation, so they construct a very large portion of Native American tribes. They are primarily located in Robeson County, North Carolina, and among neighboring counties. There are about 40,000 Lumbee natives in the entire nation. Although many migrate from Robeson County, they often return to Robeson County to be around friends, family, and others like them. This is a map of their geographic location in the state of North Carolina. The Lumbee Native Americans are primarily located in Robeson County, and they may migrate to other counties surrounding them, but many return to Robeson County. The Lumbee tribes have lived in harmony with their white neighbors during the 19th century. In the year 1835, the Lumbee natives had their basic civil rights taken from them, and they began to suffer discrimination along with other persons of color during this time period. Following the Civil War, there were not many jobs available to the Lumbee natives. They were often in a different social class than the whites and often worked under them. Even today, there are not many Lumbee natives in the white-collar or even blue-collar jobs. They often have to move to find more industrial locations to find work. So as you can see, the discrimination that they were subjected to in the year 1835 has followed them and led to results even lasting well into today. Prior to the 1835 constitutions, Lumbee natives were classified as free persons of color. After the 1835 constitution, they were unable to vote for things like state legislation. They were subjected to many of the same oppression as other persons of color. There were many court cases in which Lumbee natives sought to fight this oppression, and during the Civil War they were forced into hard labor and starvation and other harsh treatment. There was an 8-year war in which a home guard shot Lowry's brother and father while he watched from hiding. After this event, Lowry and a band of Lumbee natives waged a war. The purpose of this war was to avenge the wrongs that were forced on the Lumbee natives. The Lowry Band, as they were called, was outlawed and pursued by the militia. The Lowry Band ended up killing 18 men, and the reward for Lowry continued to rise until he mysteriously disappeared in February 1872. Lowry remains an important symbol to the Lumbee natives. His war that was waged on them lasted 8 years, from 1865 to 1872, and many people regard him as someone who stood up and fought for the oppression and took a stand for Lumbee culture. In the 1960s, the Lumbee natives became increasingly aware of their Indian status and in turn became more politically active. Although the Lumbee natives are recognized as American Indians, they are not federally recognized as an Indian tribe to this day. This is something that is sought to being changed in federal legislation. So this is something that the Lumbee natives are actively seeking. They actively want to be recognized as a federal Indian tribe. The Lumbees have a strong history in religion, although it's basically based in Baptist and Methodist affiliation, and they are predominantly Christian. There's little to no evidence of the religion that they were before they converted to Christianity. Religion is very important to the Lumbees as well as the physical entity of the church. So they really enjoy going to church, the process of going to church and being in the physical entity of a church. And they also have these amazing singing convention in which all the members from these different churches come together and where they just sing gospel music. And sometimes these conventions can last hours upon hours or maybe even days. Church is a fundamental part of the Lumbee practices, and there are over 130 Lumbee churches in Robeson County alone. Faith and church attendance are also really important. As I said, the physical structure of the church is very important, so the act of actually going to church is very important. Gospel music is also a key factor in Lumbee culture, and we talked about the music festival that they have and where all the different groups come together to sing gospel music. And the Lumbee Native Americans also hold the Lumbee River in Robeson County near and dear. So that is the river located right in Robeson County that they all kind of live around, migrate around, and it's very important to them, and they actually themselves will call it the Lumbee River instead of the Lumbee River. Even after some have moved away from the area, there is a Lumbee homecoming, usually near the 4th of July, in which those who have moved away or retired come back to the Lumbee River for a celebratory homecoming. So you can obviously see that the Lumbee River in that area in specific is very important to the Lumbee Native Americans. There are health and barrier beliefs. There are health beliefs, and then there are barriers to these beliefs that the Lumbees face. So in Native American culture, the body and the soul are in fact one. So when we think about how the body and soul are one, we need to think about holistic healing and how the body and the soul are connected, and that health is the harmony of the body and the soul with nature. So they're very big on what's around them, their environment, and their nature that they live in. There's a lot of mistrust with Native Americans and the outside community due to the oppression and the discrimination that they have faced in the past. It's usually more likely that they will seek care from traditional healers than from the healthcare system itself. There are also barriers to healthcare access, such as lack of insurance, lack of transportation, lack of healthcare providers in the areas where the Native American lives. Simply put, they don't have the money to cover their visit, any way to get there, and they don't have any close medical providers where they live. So without transportation, there's no way that they would be able to get to their appointments if they're not close by. Also, a lack of education can impact the amount of information from healthcare providers. So something that I found in my research that was interesting was that a lot of healthcare providers maybe that they see are not as qualified to see them as, say, we would like our medical professionals to be when we go see them. And there's a lot of other barriers discussed later on that are interesting when you actually get a Lumbee Native to a healthcare professional. Okay, so there are many illnesses that would affect this group particularly, but one that I found incredibly interesting in my research was Native American myopathy, and it's a genetic disorder found only in the Lumbee population, and it affects the muscular system. So in this illness, children affected with this disease are not given long to live because they cannot get the necessary nutrients that they need. I read about one case in which a child had this and he couldn't nurse because the muscles in his neck and his tongue would not allow him to nurse. So obviously if you're not nursing and getting those nutrients that you need right after you're born, it would be difficult for you to survive. The gene for this disease has been isolated, which is the first step to treating the disease. So we've isolated this gene that we know causes the disease, but there's no way to treat it quite yet. While today the conditions are treatable, they're not curable. Many have to work with physical therapists and undergo surgeries. It is estimated that to affect 1 in 5,000 Lumbee Native Americans, although the numbers have the potential to be higher, and no one recognized it before the disease was named and diagnosed the first time. So health maintenance would obviously be an important part of Lumbee tradition, strictly because they don't have access to the health care that they really need. And if they don't have the access, then they need to do something now to prevent them from getting sicker. So health maintenance is really important. The Lumbee tribal chairman has been promoting the importance of a healthy lifestyle. One project that was worked on specifically was a healthy Lumbee cookbook. So the cookbook took recipes from the elders of the tribe, and they made this cookbook that could be sold for profit just to keep the project going. where they wrote down healthy recipes, things that would be good for them to eat regardless, and in place of other things that may not be as good for them. So the Lumbee natives also host an annual healthy collard green cooking test. So this is pretty interesting because they're hosting things in a fun way. So like a cooking contest would be a really fun thing to do, and they host it to cook only collard greens, specifically collard greens that are healthy. So this also promotes that you can have fun, but you can also eat healthy. And they also participate in a fresh fruit fest annually, which promotes healthy snacking. So instead of grabbing, like chips, things like that, you can just grab healthy fruit, and that will promote a healthy snacking. The Lumbee youth also started a garden project in which they grow their own vegetables for healthy diets. So this is important to teach the youth, especially how they can grow and manage their health.
Consideration with this culture. With time orientation is present time. Personal space varies, but it is more important to watch for body language with both the patient and healthcare provider for the Lumbee Native Americans. Eye contact varies with different cultures, but the Lumbee Native Americans' direct eye contact may be considered rude. Healthcare providers should be aware of this and not disrespect the patient. Social organizations is extremely family-oriented with both biological and extended families. The number one biological variation is cardiovascular disease, which will be explained later in this PowerPoint on health-related issues, but some other biological variations are cirrhosis of the liver and diabetes mellitus. For cultural factors affecting healthcare, gender role expectations were the men used dogs and weapons to hunt, cleared the land, and built the homes. Women owned the homes, which means they have the power over the families by serving food, making clothing, and also farmed. Cultural factors. Many Native Americans, including the Lumbee tribe, focus on the holistic approach of healing, which is the mind, body, and spirit. The medicine man, or healer, is one who practices and leads traditions and healing methods. Spector 2013 states, total harmony with nature and having the ability to survive under exceedingly difficult circumstances is the belief about health and healing. With this environment, the Lumbee Indians are known for their Indian cabins, wooded areas, and swamps. Their beds are made on the floor, generally in a clay floor in the cabins. Near the cabins are well watered. They use dogs for hunting wild animals. There is also cleared acres of land to farm for food such as corn, potatoes, and rice. The Lumbee Indians enjoy hog killing, which is an event. They also do daily rounds of milking, feeding, gathering, and, depending on the time of the year, planting, cultivating, and harvesting food. The environmental factors can affect health with being in a rural area. Farming and hunting affects the health positively through nutrition, but if a drought comes, harsh winters, or hurricanes, being in North Carolina, that can affect their health with lack of food and access to health care. Social factors affecting health care. Education. The Lumbee people have been recognized by the state of North Carolina since 1885, and at the same time have established a separate school system that would benefit tribal members. In 1887, the state established the Cochin Normal Indian School, which today is known as the University of North Carolina at Pembroke. With it being an urban environment and 43% of Native Americans live in rural areas, there are issues still today with unemployment, lack of education with the elderly, and language barriers. Class structures. The whole community is considered family. Strength and support is found throughout the community. There are community issues, it impacts everyone. Due to the benefits and traditions of healing, this may affect the patient by not seeking or able to seek correct treatment in an emergency situation. Environmental factors affecting healthcare. Disease such as mental illness, like suicide, cardiovascular disease, diabetes, and cervical cancers are all higher than other races due to different effects such as environmental, social, cultural, and other factors. With the environment, a lot of rural locations, availability of specialized healthcare services is scarce. There is difficulty to recruit providers, so this culture relies on home remedies and traditions to help with the healthcare along with a medicine man. It is a challenge to acquire culturally competent providers within the Native community. Also with disasters the Lumbee Indians have gone through, there is a high risk for PTSD and alcoholism due to the higher trauma that has been exposed from wars.
As Jacqueline previously mentioned, cardiovascular disease has a large effect on the Lumbee population. The health issue of our presentation focuses on the high incidence of cardiovascular disease, along with the associated risk factors present in the Lumbee community. It's important that we first define what cardiovascular heart disease is. Cardiovascular heart disease is essentially a class of multiple diseases that all involve either the heart or blood vessels. While the different disease states differ, the underlying cause for the major forms of heart diseases typically involve a process known as atherosclerosis. The process is initiated when low-density lipoproteins, also referred to as LDLs, make deposits of cholesterol in artery walls. The body's innate immune system delivers macrophages to encase these deposits of cholesterol, becoming what are known as foam cells. As these foam cells continue to accumulate, a fatty streak develops and eventually develops into what is known as plaque. This plaque, located in the artery walls, narrows the amount of possible blood flow and can develop a fibrous coating. If the fibrous coating weakens, however, due to continual buildup of cholesterol, the hardened coating can break apart, forming clots in the bloodstream. The image on the right depicts a blood clot that has formed at the site of the initial plaque rupture. The result of clots such as this can be myocardial infarctions, also known as heart attacks, which occur when the heart muscle is deprived of oxygen by a blocked artery, or a stroke. During a stroke, there is poor blood flow to the brain, resulting in cell death. Other cardiovascular diseases that may occur are heart failure, arrhythmias, or irregular heartbeats, and heart valve problems. In general, risk factors for cardiovascular disease fall into two categories: modifiable and non-modifiable. Modifiable risk factors, or risk factors that can be influenced by the behavior of a patient, include hypertension, tobacco use, diabetes, physical inactivity, high cholesterol, and obesity. Non-modifiable risk factors include age, gender, and genetics or family history of heart disease. Cardiovascular disease is a highly prevalent disease in the United States, with 1 in 3 American adults suffering from some form. Every year, 600,000 people die from cardiovascular disease worldwide. In addition, the disease is a massive financial burden on our healthcare system, with the total cost for cardiovascular disease in the United States in the year 2010 totaling $444 billion. Although cardiovascular disease is a very prevalent and important healthcare matter for the general population, it is an even more crippling healthcare crisis among the Lumbee tribe of North Carolina. In general, the Native American population as a whole sees increased risks for cardiovascular disease as compared to the general population. So, While we are investigating the Lumbee people in particular, as they are more significant to our general region, it is important to not forget that these statistics generally will apply to the American Indian population as a whole as well. Duke University Medical Center conducted clinical research to investigate Lumbee health patterns in particular. They found that Lumbee natives who came to the hospital for heart treatment had higher rates of cardiovascular disease risk factors, including diabetes, hypertension, and prior history of coronary artery disease and heart attack than the general population. They also determined that these patients were more likely to be younger than the general population visiting for heart treatment and female. Data was analyzed from 1969 to 2006 for patients who received heart procedures. There were a number of statistically significant differences that were noted between the Lumbee population of patients and the non-Lumbee population. The average age of Lumbee patients was 60 compared to an average age of non-Lumbee patients of 64. Hypertension was noted in 70.9% of Lumbee patients compared to 62.5% of non-Lumbee patients. 37.6% of Lumbee patients were found to have diabetes compared to 28.1% of the non-Lumbee population. Finally, 51.7% of Lumbee patients were found to have a family history of heart disease compared to only 38.8% of the non-Lumbee population. As noted in the previous slide, the research indicated a clear higher incidence of cardiovascular risk factors among the patients of Lumbee descent. Lumbee patients had higher rates of hypertension, diabetes, prior heart attacks, and family history of heart disease. It can be inferred that due to the greater incidence of these risk factors, the age of disease onset is thus lower than the age of non-Lumbee patients seen at the hospital. Other differences among the Lumbee patients seen versus the non-Lumbee patients population center around actions taken upon discharge from the hospital. Researchers found that within 30 days after hospitalization, Lumbee patients were less likely to adhere to prescribed or recommended drug treatments than their non-Lumbee counterparts. This included less administration of statins, which help to lower cholesterol, ACE inhibitors, which are used to help lower blood pressure, beta blockers, which also help to lower blood pressure, as well as treat heart failure, and aspirin, which is often used as blood thinner. It is perhaps not surprising then that 9 years after initial hospitalization, Lumbee patients were found to be more likely to have suffered from at least one non-fatal heart attack than their non-Lumbee counterparts. It's important that we not only be aware of significant health disparities that exist within the Lumbee population, but also understand how these disparities may relate to their own health beliefs, maintenance of health, and practices of disease prevention. In the last slide, we touched on the fact that Lumbee patients were less likely than their non-Lumbee counterparts to adhere to a prescribed pharmaceutical regimen. General research of Native American practices have shown that there is less overall preventative action taken for health than is seen among other cultures. For instance, one study undertaken found that 73% of American Indians reported having no flu shot as compared to 66% of the general population. The trend echoes the findings of the Duke research, indicating less action taken for heart patients to prevent future cardiac episodes. Another study researched the oral health care practices of the Lumbee tribe. This research found that many Lumbee people believe that it is natural to lose teeth, suggesting that they may see preventative care as unnecessary. This, in combination with barriers to dental care that are commonly noted among the Lumbee population, including costs and inability to leave work, result in an overall decrease in preventative healthcare actions undertaken. Although oral health care is not directly related to cardiac health, There are many studies that indicate that there may be a link between unhealthy gums and heart disease. Physical inactivity, as discussed earlier, is a large risk factor for cardiovascular diseases. Behind obesity, physical activity levels are the largest disparities that are seen between the white population of North Carolina and the American Indian population of North Carolina. Research studies have shown that 71% of American Indians report not meeting physical activity levels, while only 59% of the white population reports not meeting these levels. Fruit and vegetable consumption among Native Americans is low, with 80.3% of North Carolina American Indians reporting consumption of less than 5 servings of fruits and vegetables per day. In comparison, 74.8% of the white population of North Carolina reported consuming less than 5. Traditionally, tobacco use among the Native American population has been found to be widespread, with many tribes incorporating it into religious ceremonies as well as for social activity. One study researched the use of tobacco amongst LUMBEE women and found that 20.6% use smokeless tobacco. In comparison, just 1.3% of the general population of women in North Carolina reported using smokeless tobacco. In general, there is a clear trend seen among Native Americans and the LUMBEE tribe of less adherence to lifestyle modification, and as a result, less overall disease prevention or protection. It is important to consider the impact that religion and social factors may have on both the health issues that are prevalent within a community and also the types of health maintenance that is practiced, or, as for many LUMBEE people, what is not practiced. To start, it should be noted that the general trend seen among American Indian households is low socioeconomic status. Around 50% of American Indian households earn less than $25,000 annually compared to just 27.1% of the white population. This low socioeconomic status is important as it is considered a large contributing factor to poor health outcomes that are found to be prevalent among Native Americans. We are able to see the probable impact that this has even on the health issue at hand. For instance, we can consider the difficulty that a LUMBEE family with an income of less than $25,000 might have with obtaining enough fruits and vegetables for their household to equate to 5 servings per day per household member. One can quickly see how this may be challenging and how general socioeconomic disparities may act as a hurdle for obtaining optimal health. The LUMBEE population has been found to be largely Baptist or Methodist. Religion is an important aspect of their daily lives, and it tends to act as both a religious and social experience, with much of the community coming together for church functions. While Christianity has been highly practiced within the community for several centuries, it is believed that the LUMBEE people have weaved their traditional spirituality with Christianity. This stands in contrast with some of the attitudes that other American Indian tribes had against Christianity. Some tribes viewed Christianity as something else that the white men were forcing upon them, much as they forced other aspects of their culture on them. The image to the right depicts the blend of Christianity with traditional practices and spirituality observed by the LUMBEE Indians. The religion of the LUMBEE people can be viewed as significant in relation to health issues because some of the elders in the community actually grew up during a time period where there was less healthcare access available. As a result, the members of the community relied on their faith in God to improve and maintain health. Relating to their strong beliefs in Christianity, members of the tribe believed that God has provided the tribe with traditional methods. That is, they believed that God had equipped upon them the necessary skills to practice certain healing methods. Some of the methods used were talking to the altar or laying of the hands, which is practiced by those who are given the gift and are believed to be anointed by the Holy Ghost. The practice involves anointing the sick patient with oil and praying over them. Those who practice the method speak to the ailment and command it to leave the body. A prayer cloth is used in healing practices as well. This method involves using a white cloth that represents purity and sanctification, seen in the photo at the right, that is prayed over and anointed with oil by the leaders of the church. This cloth is then given to a person who is fighting a chronic illness. The belief is that the faith of all those who prayed into the cloth will follow the patient and be continually sent up for the person who holds the cloth. Blowing fire is a practice that involves someone who has been given the gift of healing and a sick patient. The healer is believed to possess a God-given ability to blow or talk directly to the energy causing an illness, causing it to leave the individual's body. While these practices are not actively used by all modern Lumbee people today, they are still important to be aware of because they may affect the way that some community members go about treating cardiovascular heart disease or associating risk factors. In general, we would most likely see this occur in older populations of the Lumbee tribe. Finally, it is important to consider the relation that healthcare access has on increased cardiovascular disease incidence among the Lumbee population. While North Carolina has 8 different organized Indian tribes in the state, only the Eastern Cherokee tribe is federally recognized. Because the Cherokees are the only tribe to be federally recognized, they are the only tribe in the state with access to Indian Health Services facilities. This is quite significant when one considers that Eastern Cherokee Indians make up only 15% of the total North Carolina Native American population. While the Lumbee community is able to seek health care from any healthcare facility, there remains still a segment of Native American individuals who do not feel comfortable being treated in a fully Western clinic. As a result, this may contribute greatly to whether a Lumbee seeks out health care. General research that has been conducted on American Indians in the United States has found that the amount of Native Americans without health insurance is greater than the white population, with 19% not having insurance compared to 13.4% of the white population. 29% of American Indians reported being unable to see a doctor within the last year due to a financial burden compared to 12% of the white population. And around 22% of American Indians reported not having a personal doctor. Only 16% of the white population reported having no personal doctor. Other research has indicated that the percentage of the white population in the United States that has reported being retired is 2 times as much as the amount of American Indians reporting retirement. Although this is not entirely surprising, as earlier we discussed the socioeconomic disparities found among American Indians, it is significant because we also know that leaving work is considered to be a burden for American Indians seeking out health care. Consequently, the longer that American Indians work, the more likely they are to put off seeking health care access. In relation to cardiovascular disease, it is especially significant as we know that age is considered a risk factor. Therefore, later ages of retirement and subsequent lack of health care attention further perpetuates the cycle of increased likelihood of health care disparities seen amongst this community.
Missteps U.S. healthcare providers would make. 1. Talking too much while the patient is in the room. Lumbee Native Americans like time and silence. Making direct eye contact. Lumbee natives prefer to avoid direct eye contact out of respect or concern for soul loss or theft. Using the traditional/Western approach. Lumbee natives use the holistic approach, which includes the mind, body, and spirit. Giving a prescribed medicine to treat an illness. They will most likely want to seek a traditional healer for their illness. And lastly, a U.S. healthcare provider might touch their patient to find out where the pain may be located, but if they do not ask for permission or tell them what they are about to do, the LUMBEE patient will find that very disrespectful and may not trust them. Ways the LUMBEE culture is connected to the U.S. For the LUMBEEs, religion is very important to them. Their churches have Sunday school, youth organizations, senior citizen programs, and choir practices. This is connected to the U.S. because religion and attending church is a key element of people's lives in the United States and other major regions. Another way LUMBEE culture is connected to the U.S. is by one notable event known as the Lowry War. Henry Berry Lowry, a LUMBEE native, started a war against the white men and was honored by the LUMBEE people. He started this war to help with the oppression of the LUMBEE people. The next two slides are the reference slides that give a brief description as to why we chose to use those particular sources. Overall, the LUMBEE culture was very intriguing to learn about. I hope you all find this culture as interesting as my group members and I did. I hope you enjoyed this presentation and was able to get more insight about the LUMBEE Native Americans.